Can a medical device restore your balance? Nearly 2 million people worldwide have lost the simple ability to feel steady. Now researchers have developed an experimental medical implant that promises to restore the sensory machinery responsible for balance. Opener V3. The patient looks through measuring goggles at a series of markers on a grid. Dina Litovsky. Sushma Subramanian. Photographs by Dina Litovsky. July/August 2025. Get our newsletter. Key takeaways. What are vestibular disorders? People with vestibular disorders have trouble maintaining balance or other problems with vision, touch, and body positioning. 20% of people experience vertigo at some point in their lives. A new medical device works like a cochlear implant and has shown impressive results treating vestibular disorders. For almost 4 years, Richard Stevens' brain felt as if it were jiggling around inside his skull. If he turned his head, his vision wobbled for a few seconds before it became steady again. To cope, he had to constantly pause to stabilize himself and make every movement deliberately to avoid getting a headache. Though he initially had to be in a wheelchair, he trained himself to walk around with a cane and even to keep working his job as an employee benefits counselor, though he had to be driven there. Stevens already knew what ailed him: bilateral vestibular loss. He no longer had function in the sensory machinery responsible for balance. The involuntary movement of his vision was a common symptom. The trouble had begun after a motor scooter accident. The hospital treated him with antibiotics, and as happens in rare cases, the medication damaged the hair cells in his inner ear that detected his body's motion. Simple tasks like eating popcorn during a movie were out of reach, and he was prone to falling. He lost tens of pounds of muscle, no longer able to do his fitness training. His condition was irreversible, so he was prepared to deal with it for the rest of his life. It was just mind over matter, that you knew the sidewalk was not moving and it was just your vision making it look like it was moving, he said. I just progressed to the point that I could do things, but it was with severe restrictions. Opening image. A patient at Johns Hopkins sits in a rotary chair. As her body turns, scientists measure how her vestibular system steadies her eyes. Dina Litovsky. Most people can't imagine losing their sense of balance completely. But simply walking around depends on the vestibular system. It sends messages to the brain that combine with other information such as vision, touch, and an internal understanding of body position, called proprioception. The invisible nature of this system makes it hard to recognize. We take it for granted, until it goes awry. While only about 1.8 million people worldwide have severe vestibular loss, partial loss is extremely common. Some 20% of people experience vertigo at some point. And falling is the #1 cause of death from injury in the elderly because people lose their sense of balance as they age. I'd argue there's no area of medicine where there's a bigger discrepancy between the number of people who suffer from a problem and the number of providers who are trying to take care of those patients, says Jeffrey D. Sharon, director of the Balance and Fall Center at the University of California, San Francisco. In 2016, Stevens took friends' advice to reach out to hospitals that were researching potential cures. He emailed Charlie Della Santina, an inner ear specialist who is also an electrical engineer, a biomedical engineer and a neurophysiologist, and director of the Johns Hopkins Vestibular Neuroengineering Lab. Della Santina called him half an hour later. There is hope, Stevens remembers Della Santina telling him. Around this time, Della Santina had received FDA approval for a trial designed to test a new inner ear implant to restore balance. Stevens would be the very first person in the world to take one home with him to test out. Stevens felt like he had nothing to lose when he traveled from his home in Southlake, Texas, to Baltimore for his surgery. A vestibular implant is a device that measures motion using a sensor that's attached to the side of a patient's head with a magnet. It conveys information using a series of electrical impulses that get transmitted directly to the vestibular nerve through a device placed in the inner ear, bypassing the damaged ear cells. The system looks and functions much like a cochlear implant, which restores hearing. Cover image of the Smithsonian Magazine July/August 2025 issue. Subscribe to Smithsonian Magazine now for just $19.99. This article is a selection from the July/August 2025 issue of Smithsonian Magazine. Subscribe. Dr. Della Santina. After working on devices to fix hearing loss, Charlie Della Santina, an engineer and a doctor, invented an inner ear implant for balance. Dina Litovsky. When Stevens went back 3 weeks later to have the implant activated, Della Santina warned him that it would take time to adjust to it. But right there in the office, Stevens felt as though there was an electrical current firing through parts of his brain that controlled his sense of balance. He noticed that his eyes weren't darting around as usual and he was stumbling less, though he still needed the security of his walking stick and his wife, Susan, next to him as they made their way to their car. I turned to her and said, "It's almost like it's normal," he recalled. The couple spent the weekend in nearby Annapolis, where they walked along the Chesapeake Bay and ate crabs. Stevens folded up his walking stick to experiment without it, and when his wife reached for his hand, he told her he was okay. When they were in the car, he didn't have to close his eyes to keep his vision from bouncing around. While the shaky sensation didn't go away completely, the scene in front of him didn't appear to swing several feet as usual, just a few inches, which he could manage. On Sunday night, while the couple was sitting in bed, the hotel room suddenly looked to him like it had turned upside down. Disoriented, Stevens fell over onto his wife as she sat next to him trying to type on her computer. She told him it wasn't funny. But it was no joke. It looked to him as though the room was flipping back and forth, and he had to hold on to the comforter to keep himself from falling off the bed. When the movement stopped, he called Della Santina, who sympathetically reassured him that it would take some time for his brain to accept the new inputs and that they could talk about it at his appointment the next day. "Bear with it," Della Santina told him. "It's a learning curve. Because almost all creatures need to sense gravity, our ability to balance has ancient origins. Even plant roots know how to grow into the earth, while stems know to move up toward the light. That might be considered a rudimentary vestibular system. As soon as there were animals that could move, they needed to keep themselves stable and reflexively adjust their heads and eyeballs, like a Steadicam. A jellyfish has mechanisms called hair cells that, when brushed up against beach sand, tell it where it's tilted in relation to gravity. A fish has a line of hair cells that help it turn into the flow of water and control its oxygen absorption. The vestibular system of reptiles and mammals relies on the movement of hair cells within the watery landscape of the inner ear organs. 2 inner ear structures called otolith sensors detect both head motion and the pull of gravity, while 3 structures called semicircular canals specialize in sensing quick head rotations, driving a reflex that keeps our eyes and vision steady and clear. Fundamentally, the system works by detecting the movement of fluid within. Your inner ear is just an internalized version of the ocean that you have learned through millennia of evolution to carry around with you, Della Santina says.